I want to wish all of you a very good morning, good afternoon, and good evening to all of you joining us from around the world today. Thank you so much for giving us an hour of your day and joining us for this informational webinar for Rotman School of Management's upcoming online program, Healthcare Analytics, AI, Big Data, and Digital Transformation. And on behalf of everyone at Emeritus and the University of Toronto, thank you again for giving us some of your time today. So without further ado, I would love to introduce our amazing rockstar faculty that we have on the line with us today. We have Dr. Avi Goldfarb on with us today. Dr. Goldfarb is the Rotman Chair in Artificial Intelligence and Healthcare, Professor of Marketing, Chief Data Scientist at the Creative Destruction Lab, Senior Editor at Marketing Science, and Research Associate at the National Bureau of Economic Research. Dr. Goldfarb, along with two others, is the author of the Globe and Mail bestselling book, Prediction Machines, The Simple Economics of Artificial Intelligence, and has published more than 70 academic articles in a variety of outlets on the topics of marketing, statistics, law, computing, and economics. And this work has been discussed in White House reports, congressional testimony, European Commission documents, and others. We are thrilled to have Dr. Goldfarb on the line with us today. Good morning, Dr. Goldfarb.
Good morning. It's great to be here, Mark. Hello, everybody. Welcome to our marketing webinar.
And like I said before, my name is Mark Linehan. I'm just a humble player with Emeritus who is thrilled to be on the line today, helping answer your questions and teach you more about this program. So who should attend this program? So one of the things I said at the beginning was, what brings you to this course today? And so for those of you who might be listening and on work and unable to hear to read the slide right now, this program is specially designed for business leaders, managers, and entrepreneurs who engage with data teams and want to have more meaningful conversations with them and want to integrate data into their decision-making in healthcare and their corporate culture. So this program, the way that Dr. Goldfarb built this course, this program is particularly applicable for C-suite executives from the healthcare industry with access to a massive data stream who are seeking to implement analytics solutions in their unit, learn the language of data, and develop an analytics roadmap for their organization. So if that sounds like you, this course is for you. This course is also for mid to senior level managers. So if you have a title such as general manager, corporate director, head of marketing, or head of strategy, and you're seeking to garner insights from data, or if you're looking to gain a practical understanding of the applications of analytics to initiate new projects or launch new business ideas, then this program is perfectly built for you. And also, if you're a healthcare entrepreneur or a consultant, and you're looking to set up an analytics team and understand the concepts and tools for business and clinical intelligence to improve your product or service offering, this course, this program is also for you. So if that sounds like you, we are thrilled and happy to have you here with us today. So what's going to happen is right now, we're going to go through a program overview. We're going to go through the curriculum. We're going to go module by module, week by week, and go through what you're going to be learning about. I'm going to briefly tell you a little bit about what your learning experience will be, and then we're going to answer as many of your questions as possible before we get to the top of the hour, and we have to let you all go. So with that, it is my thrill and honor to hand things over to Dr. Goldfarb. Take it away, sir.
Thanks, Mark. Welcome, everybody. This is going to be a course about healthcare data. So what does that mean? It means there is incredible opportunities in healthcare because of the stream of data. It's a result of digitization. At the same time, like many other industries, healthcare organizations struggle to make sense of the data and know what to do with it. And so what this course is designed for is to give you a sense of what data can do for you. What can data do for a healthcare organization? To be clear what it is and what it is not. So at the end of the program, you'll be able to communicate effectively with analysts who themselves are statisticians and know how to work with the data. You'll be able to identify strategies to employ data for optimal healthcare outcomes and outcomes for the business around healthcare. And you'll be able to build a roadmap to drive analytics in your healthcare organization. So that's what it is. That means what it's not is a highly technical stats course. So you do not need a deep background or any background in statistics or computer science or linear algebra or calculus or anything like that. What you need is an understanding of business applications, of practical applications, and practical issues in healthcare organizations. And what we will do, what the course does, what I do, is give you a sense of where where data can help you achieve your goals within those healthcare organizations. The way we think about this, the language we use at Rotman around data is the idea of data literacy. So you need to be able to understand what data can do for you. You need to be able to communicate with data analysts, essentially knowing what questions to ask and how to interpret the answers and what follow-up questions. You need to be confident enough to ask for data analytics that help your organization, that help you do your job better. And you need to be confident enough to when analysts respond with an answer, to be able to interpret it and know what it means. Part of that means you will get expertise to interpret analyses that you may do or that others may do in the context of data-driven decision-making. Right? So the goal of data, the goal of analytics is to help the company, to help the organization do better. And so the key theme, the key lens that's going to happen almost every week, every module in this course, is to focus on how does this data help the healthcare organization? How does it improve outcomes for patients? How does it improve my goals, your goals as a manager? And finally, we want to understand the importance of a handful of new tools that are emerging in healthcare. An emphasis on artificial intelligence. So my title at the University of Toronto is the Rotman Chair in Artificial Intelligence in Healthcare. And so what I will be bringing is my research on opportunities in healthcare and how AI can transform healthcare to the classroom to give you a sense of what it might mean for your jobs, for your organizations, and help you identify big opportunities down the road that can help advance your careers. So how does the curriculum play out? It's going to play out in 7 different modules. We're going to start with the basics. What is data? How do you use them? How do you categorize it? Different types of variables. What might you worry about as you're doing data analytics in the context of your industry, the healthcare industry? That's piece 1. Module 2 then says, well, now that we know what data is and how it works and what it's for, how do you build what we call a dashboard that helps you understand what's going on in the organization through data? And a key decision here is to identify what are called the key performance indicators, KPIs, the things that you need to know on a day-to-day, week-to-week, month-to-month basis in order to manage your organization. And so we will spend time, just like the dashboard of a car tells you the most important things. You need to know the speed, you need to know how much fuel you have. A dashboard for an organization tells you the key performance indicators, the things you need to know in order to drive your healthcare organization. In module 3, we're going to change direction a little bit, zoom out, and think about the opportunities in AI. So this builds on the ideas that Ajay Agrawal, Joshua Gans, and I wrote in our book, Prediction Machines, and on some of the academic work I've done with colleagues in the medical school on how do we think about the opportunities in AI in healthcare. And so the big picture is going to be to recognize that when everyone's talking about AI today, they're not really talking about a truly artificial general intelligence like you see in the movies. It's something very much narrower. It's data science, it's statistics. Prediction has gotten much better. And once you understand that, you can think through how is that going to affect your own organization. And you're going to get a tool there. It's called the AI Canvas, which is a translation tool between data scientists and people who understand how to manage the healthcare organization. Module 4 is going to be teaching the workhorse tool in statistics, something called regression. Okay. This, the analysis here requires no background stats, no background math, no background computer science. What I found, the way I teach regression, those who have a technical background learn about the intuition of how it works and tend to very much benefit from that teaching style. And those without a technical background get an understanding of what the tool does and what it's for. So again, by focusing on the intuition about what this highly technical tool does, both those with a technical background and those without, learn essentially how to talk to each other better. And that's what Module 4 is about, learning how to do regression in a healthcare organization and what it might be for. Module 5 will do what's called prescriptive analysis. So AI, when we introduce regression, that's in the context of what we call prediction, which is the process of filling in missing information. That doesn't tell you, that tells you what will happen if you don't change behavior. It doesn't tell you what will happen if you behave differently. That requires what's called prescriptive analysis. The decision of, if I did something different, how would things play out? If I raise prices, will I lose too many customers? If I change the treatment that I offer patients, are they going to do better? Things like that. That prescriptive analysis requires scientific thinking. And in healthcare, you're generally good at scientific thinking in the context of patient care. The big surprise I found in talking to many, many healthcare organizations is the scientific thinking somehow stops at the door of management. Even scientists, people trained as scientists who understand data-driven decision-making and scientific thinking in the context of patient care, as soon as they become managers, they forget all of that and think there's some magic here. And the point of Module 5 is to teach you there's no magic here. Those tools that you learn in scientific thinking, and you know about, generating hypotheses, testing them in order to make better decisions in the context of patient care, are also true, generating hypotheses and testing them in order to make better management decisions for the organization. In Module 6, we'll talk about how data and the opportunities in data are changing healthcare more generally. And what it is as healthcare becomes digital, as it becomes digitized, there's a number of changes happening in healthcare organizations that lead to new opportunities. So this is taking a step beyond data to think about what digitization means in terms of enabling search and better matching of patients to treatments, or for the enabling better monitoring and new ways to treat patients at home, enabling telemedicine, and new opportunities for some medical organizations to expand their reach and help people in other parts of the world. So Module 6 is going to be about the impact of digitization generally, starting with data and then thinking through what that means for digital communication, digital search, and et cetera, in order to help healthcare organizations. And that's going to be partly based on some work I did, again, with colleagues in the medical department in the medical school at University of Toronto, in managing the transition in March 2020 around COVID-19. Module 7 is going to be zooming back out to think about the big picture. How do you manage a data-driven healthcare organization? What are the challenges to changing the culture? How do you deal with questions and concerns around privacy? And there I'm going to draw on my testimony to the US Senate Committee of the Judiciary from 2019 on digital advertising and privacy. And so that section is going to say, okay, well, now that you know what data is for, how do you make it happen in your organization? What do you need to overcome? What are the first, what are the baby steps that you can start with? And how do you think through the big picture of where you want to be? So those are the 7 modules. And at the end of those 7 modules, you'll get a sense of the big picture opportunities in healthcare for data and healthcare. And you'll get a sense of the day-to-day opportunities, the day-to-day, what can data do for you, and how can you use data to help advance your career?
Thank you so much, Dr. Goldfarb. All right, so Dr. Goldfarb talked about the 7 modules. He talked about the content that you're going to be learning. So how are you going to be learning it? Well, you're going to be learning them through a diverse group of methods. You're going to be having different try it activities and real world application exercises. So a lot of online programs, especially early on in online education, were just simply just information thrown at you. A lot of people just think of like just watching videos and things like that. But this is so much more than that. We have made sure to build a dynamic program that will engage you on many different levels. No matter how you prefer to learn, you are going to feel supported during this program. So whether it's tried activities and real world application exercises, whether or not it's quizzes and knowledge checks to make sure that you are meeting the goals that are set out every single week. Peer discussion groups. We're going to have learning facilitators. They're going to be moderating discussions between you and your cohort. So this will feel more like a class. This will feel more like a cohort than other old-fashioned online programs might have done. You actually will get to know the other people in your cohort and learn together. There will be open Q&As. There will be constant communication between you and our learning facilitators. There will also be a live webinar with Dr. Goldfarb that you can be able to speak to Dr. Goldfarb directly. And also, there's going to be that Capstone project, which I'm sure you have many questions on already. I'm definitely planning on asking Dr. Goldfarb more about that, focusing on what you're going to be learning in the latter modules in Module 7, that Capstone project where you are going to be able to implement what you learn in this program right away in your career and in your companies. Now, once you successfully complete this program, you will earn a digital certificate of completion from the Rotman School of Management. And this program counts toward a Rotman Excellence and Executive Leadership Certificate. If you want to learn more about that, you can email rotman@emeritus.org, or you can click on the link that's going to be popping up in the chat box in just a few moments to learn more about that specifically. But this verified digital certificate, you'll be able to put this on your LinkedIn, your resume, and this will also be a great way for you to stay in touch with the rest of your cohort, but also to let current and future employers know that this is the level of knowledge you have attained. You have learned from the best. You've learned from faculty like Dr. Goldfarb at one of the best schools in the world, Rotman School of Management at University of Toronto. And so you will be able not just to possess the knowledge, but also to be able to use that knowledge to leverage in your current career and in future careers as well. So with that, program support is popping up a link in the chat box right now. It should already be there to click on that link and register for this course. I highly encourage you to click on that link right now. So please click on the link. If you're anything like me, your browser already has 50 tabs open. So please click on that link. Make this the 51st tab open on your browser. Don't miss the opportunity to join this cohort and to learn this knowledge now. So again, please go ahead, click open that link that is in the chat box. Register for this course right away. You can see the information right there. It's a 7-week course, 4 to 6 hours per week is what we think that's what you need to invest in this course, is about 4 to 6 hours per week. But again, the way that we have broken down this course, it's not the kind of thing where you have to devote 1 hour a day or 90 minutes a day or 2 hours a day twice a week like you might have in a traditional academic environment. We have broken down this program so that even if you only have 15, 20 minutes here or there, half an hour here, half an hour there, however you can cobble together 4 to 6 hours, we have made this program as flexible and dynamic as possible. So no matter what your schedule, no matter what needs are asked of you throughout your week, whether you're working from home, whether you have kids who are still learning from home, whatever you have, we feel that you will be able to cobble together those 4 to 6 hours per week. So is this course, would you consider this a healthcare informatics and management course, a healthcare data analysis program, or is this something in between?
I think it's more something in between. So it is, of the 7 modules, you can think about them as 4 focused on healthcare data analysis. What's data for? How can it help your healthcare organization? And 3 of them are more about on the management side. So the AI in healthcare, the digital healthcare, and the building a data-driven healthcare organization are all more about healthcare informatics and management. How do we think through the strategy for your organization in order to leverage the opportunities brought about by digitization, leverage the opportunities brought about by AI, and then actually make the data serve the organization in terms of building a data-driven organization. So it's a little bit of both. The framing is more on data analysis, but in order to do that, you need to understand informatics and management to make a difference.
Thank you so much, Dr. Goldfarb. So our next question is, what type of jobs can we get after this course? And secondly, will we help in securing a job position? So let me answer the second question very quickly. I would highly encourage you to email Rotman@emeritus.org for anything in terms of like what happens after the program. I know that these materials will be available to you, I believe, 12 months after the start of the program. So if you do sign up for this program, I think you will have access to the materials through, I guess that would be June 30th, 2022. But in terms of professional development or mentorship or coaching like that, I would double check I would email Rotman@emeritus.org for the second part of that question. But Dr. Goldfarb, to the first part of this attendee's question, what type of jobs we can get after this course, I anticipate that slide where we talked about who this program was built for, that's for people who currently have those positions, but also want to move into those positions as well, correct?
Yeah, that's how I would think about it, right? So what this course will do is give you the skills to understand what data can do and work with analysts to help an organization. And so any position where you're going to need to leverage data and work with analysts to identify a healthcare strategy and improve your organization is going to be a good fit for this course, and you're going to be well positioned afterwards.
Thank you so much. So our next question is, hi, with this program, are we able to extract or clean up data? If yes, what type of technology or program are we going to use?
So this is, the purpose of this course is to help you understand what data can do for the organization. There are lots of free online courses that can teach you how to code. That's not what we do here, and it's not what a business school program is about. What this program is about is taking that commodity of learning how to code and turning it into strategic advantage from a management point of view in your organization. So it's not, here's how to extract data. For that, go to YouTube, figure it out. This is strategic advantage from data in order to help an organization.
Thank you so much, Dr. Goldfarb. And when we are talking about healthcare data, asking, can we give more specific examples? One was example in the Canadian context, healthcare, are you referring to CIHI data? And they give a whole ton of examples, DAD, NACRS, OMHRS, NRS. But then we have another question later on that also asks, are we going to use CIHI data?
Okay, so this is, after this course, you are going to be prepared to work with any kind of healthcare data set, right? The goal is to think through what you want to accomplish for your career, for the purposes of your job today, and then going forward, and then identifying the right data for that and the skills to use that data. So we are, in some sense, the course is data set agnostic. We're going to use some specific data sets to give you opportunities, but it's not the CIHI data. I've worked with that data before. It's awesome data. And after this course, you will be able to use it. But that's not the data sets that you're going to manipulate in the course are going to be designed in a particular way so that you can take the management learnings for the course without having the need for coded skills.
Are the case studies for this program, are they Canada focused or are they global?
They are global. The cases are global. So this is meant to be a global program of interest globally. There's, we talk about things in Canada. It's a Canadian perspective in some sense because I happen to be in Canada and my research collaborators happen to be in Canada. So when I talk through the process of converting, for example, Princess Margaret Hospital in Toronto and helping them move online in March 2020, well, that's a Canadian specific example of the challenges of digitization and the opportunities in digitization in healthcare and how it can respond to a crisis. Those ideas, though, obviously apply globally. And other examples are going to draw from other healthcare, other countries. Some other research I did in the context of electronic medical records is going to be quite prominent in the course in the context of when we talk about prescriptive analytics. And that tool, should you adopt EMR, and how and why and what is it for, is very much focused on the data is US market data. And so that's going to be from US hospitals adopting healthcare tech. And so we have examples from Canada, we have examples from the US, and we do have examples from around the world. So it's global, but if this were taking place, if this were a course from National University Singapore, I suspect there would be fewer Canada examples and more Singapore examples. It's the University of Toronto course, so it's going to be, we're going to have more Canada examples than we otherwise would, but it's very much a global course.
Thank you so much. So because I skipped around, now I've completely confused myself. This seems to be someone who is a physician by education. So they're a trained physician, and they're looking to shift their career to a medical data analytics job. Would this course be a good start, or should they go in a more technical entry-level approach?
It depends what you want. Okay, so this course will position you to be a manager, leveraging your skills as a physician in order to work with data analysts to improve healthcare. So if your goal is to leverage the opportunities in analytics in order to help a healthcare organization, then this is the exact right course for you. Now, if in contrast, your goal is to become a statistician and sort of, to put your physician training aside and say, no, I want to be a statistician, then you want to start with, a different, more technical entry-level approach. But let me be clear, if you're training as a physician and you're doing that at the entry level, it's entry level. And that's not an unheard of career move, but it would be a very different career. And you start back starting from scratch. So if you're thinking of leveraging your skills as a physician in order to build an organization, a healthcare organization around data, this course is a good first step.
The curriculum for this course looks great and exactly what I'm looking for, but I'm much more junior in my career than the listed requirements. They're asking if there are any other courses available, but this to me sounds like, Dr. Goldfarb, what we were saying before about who this program is built for. It's not just for people who currently hold those job positions, it's also people who want to move into them, correct?
That's absolutely right, Mark. So if you envision yourself 5-10 years from now in one of those roles, this course is gives an excellent structure for helping you get there. So if this is what you're looking for in terms of content, and you just think, oh, you know what, that's where I want to be 5 years from now, not now. Well, the course will help you, will be a piece to getting you where you want to be 5 years from now.
Thank you so much. Is there a syllabus that can be shared, including the assignments and deadlines included? The brochure is not very detailed. For you, I would say email Rotman at emeritus.org. So any kind of more detailed information that you want, if you want to get connected to a program advisor, I would definitely say Rotman at emeritus.org. Are there other courses? Email Rotman at emeritus.org, and they'll be able to connect you with, they'll be able to show you other courses at Rotman. You'll be able to get into more detailed conversations about what this course includes. So anything like that, Rotman at emeritus.org. I'm sure program support has already put that in the chat box, and I'm sure they'll do that about 17 more times because I keep saying it. Yeah, definitely get connected with a program advisor. Click on that link, and we will be able to point you in the right direction. But are there any specific, but in connection to that, Dr. Goldfarb, are there specific case studies or specific assignments like that maybe we could just give an example as to something that our students will be doing as like a try it activity or as a real world application that sets us apart from other online programs?
Absolutely. And in the process, I think I'll be dealing with Kara about the machine learning component, which is one of the try-its we're doing is to build an AI canvas. What's an AI canvas? It's a tool to help data scientists and healthcare managers communicate with each other in order to understand how to build an AI, how to build a machine learning tool. And so the center of machine learning, the opportunity of machine learning is to recognize that should be thought of as a drop in the cost of prediction. Prediction technology has gotten cheaper. That's why we're all excited about AI today. And so what the canvas is you identify specifically what prediction you're trying to make. You describe the judgment of what you're going to do with that prediction. Based on the prediction, what decisions you'll make. You describe the action you're going to take as a consequence of those decisions. And you describe the different types of data, training data, input data, and feedback data that will allow you to build your AI. And so that's an example of a triad that we have found useful, from the senior executive levels, from the CEO level down to the entry level manager, and trying to think through how do we build an opportunity, a specific AI tool that the data scientists can understand what the managers want. And so the managers can understand what the data scientists are saying. That's what the canvas is about. And that's going to be one of our, the triad activity in the AI and healthcare module. The machine learning component is understanding what machine learning can do and how it can help healthcare organizations. We will build some very simple examples through regression of the intuition of prediction technology, of the underlying stats, but we're not going to be, the focus isn't on the coding of machine learning. The focus is on the opportunity through machine learning and understanding how to build an AI strategy and how to describe an AI tool in a way that's going to help, a machine learning tool in a way that's going to help the organization.
Thank you so much, Dr. Goldfarb. And I also want to, so there's a future question, a few down from that says, Andrew recently attended the machine learning in business program. Will this augment what Andrew learned in that program, but in a healthcare setting? So I just wanted to piggyback on what you were saying about machine learning.
Okay, so this program is very different from the machine learning and business program. So that I believe is the John Hull, just confirming. If that's not what you're talking about, Andrew, then just let me know. But that is about the coding. That tells you how to code for machine learning. This tells you what to do with data and how to build a data-driven organization. So this is an intuitive course, a strategic course that helps you with the management of data and the management of data of a data-driven healthcare organization. So it's not the machine learning in business, but in a healthcare setting. It is now that you know what machine learning is for, it'll give you some intuition and some tools to develop a machine learning strategy, if that's where your focus is, or just more generally a data strategy for the business in order to help your career.
Thank you so much, Dr. Goldfarb. How many people will be accepted to this course, and is this program designed to study in cohort, or is it more individualistic self-study? So I do not believe that there is a cap, or there is no prerequisites for this program. I don't believe, Dr. Goldfarb. So if you register for this course, you're in. I'm correct? Okay, so yeah, so this will be, if 30 people sign up, if 300 people sign up, that's how many people are going to be in the cohort. Now, it is designed to be augmented with some elements of cohort learning to make it a more dynamic course. However, this is still designed to be an individualistic self-study program. So it's not like if you can't make something, like there's no, Dr. Goldfarb, correct me if I'm wrong, but there's no like group assignment that if you don't take part in, like you don't complete the course or anything.
That's correct. That's correct.
Yeah. So yeah, so there's some elements, like there are peer discussion groups just to enhance the program, but there's no you're not locked in with a group and there's a group grade or anything like that. Like this is very much like it's 4 to 6 hours per week. How you find your 4 to 6 hours per week is up to you. There is a live webinar. There are office hours and there are peer discussions. But this is meant to be an individual, built as an individual program. So friends, if you have any more questions, please put them in the Q&A box right away. I'm also monitoring the chat as well. Dr. Goldfarb, is this our first cohort, or how many cohorts of this program have we done?
This is our first cohort of this program.
This is our very first cohort of this program, so we are very excited to get this off the ground. So can you talk a little bit more about what the Capstone project is designed to do in like the way that our students will be able to take their Capstone project and apply it immediately to their current positions?
So the Capstone project is designed to help you apply the tools from the course to something that matters to you today. So if you are in an organization that is thinking through opportunities in data, then the Capstone project will be, okay, how can, in my job, how can I apply these healthcare analytic tools to help my organization and to help me in my career today? Some of you may be thinking about that as an opportunity in the future. And so then you'll have some flexibility to say, well, it's not about what you're doing today, but you can identify another organization or a particular question that's of interest to you and think through in the Capstone project how that organization might solve that problem. So to summarize, the Capstone project is designed to be flexible. It's designed to be flexible in a way that if you want to apply the tools of the course to your current day-to-day work, then that's great and it can happen. In contrast, if what you want to do is start to think about career change and apply the ideas in the course in where you aspire to be, in a year, 5 years, 10 years, we can do that. Then the project is designed for that flexibility. But the key is to practice the ideas of the course in a context that matters to you.
Is this program more strategy and management oriented? And I feel like just from what you've been saying, Dr. Goldfarb, the answer is yes. This is a management oriented program, but we're still getting questions about it. So we want to hone in on is this a more strategy and management oriented program? So
yes, I could elaborate, but just to this is a business school program in healthcare analytics. It's very different from the program that you might get in a computer science department. It's very different from what you might find on YouTube, and it's different from what you might get in a medical school. This is how do you build, how do you help an organization leverage data? It's a strategy. It is strategy and management oriented.
Dr. Goldfarb, are there any final thoughts that you want to leave with our future students? Anything else that you're particularly excited about with this program? Anything you want them to know as they're thinking about clicking on that registration link?
For one thing, it's great to see all these people coming from around the world. Part of this is the course is relevant to people around the world, and it's an opportunity to think a little bit globally. If you tend to focus on your community and where you are, you get sort of a bit of a global perspective there. The main takeaway, though, is this program is unique because it's about healthcare analytics and how healthcare analytics can help an organization. How do you, as a manager in a healthcare organization, build an analytic strategy, build a digital strategy, and build an AI strategy? And while the coding aspects of AI or data science is available in all sorts of places, what's unique here, what you can't really get elsewhere, is this management perspective about what data can do. In my background as a data scientist in a business school who works with healthcare organizations to help them develop data and AI strategies is key to making this all, is key. But it's key because it draws on my experience in order to help you build your own data strategy.
In addition to because what you just said, in addition to your extensive expertise and experience, and friends, if you joined late and you didn't hear me, very quickly butchered Dr. Goldfarb's extensive bio. I highly encourage you to look back on it. But in addition to your expertise and experience, are there also guest speakers with this program as well? Are we hearing from other voices as well?
You're going to be hearing, this program is focused on on the work that I have done with Ajay Agarwal and Joshua Gans, the business school, and with various doctors in the University of Toronto Medical School. But the voice you're hearing is mine, talking about research from that I have done with various colleagues from Toronto and around the world.
And I highly encourage all of you listening to this webinar right now, please go back and check out Dr. Goldfarb's bio, because it is extensive and I said it very, very quickly. So please go back and check that out. Check the chat box. Program support has popped it up several times. I'm sure they will do so again. Please see the link that is popping up in the chat box. Please click on that link. If you have any additional questions, please feel free to send them to rotman@emeritus.org. Again, that's rotman@emeritus.org, not edu, emeritus.org. So please send any additional questions there. I want to thank Dr. Avi Goldfarb so much, not just for his expertise and his extensive experience on this subject, but also for his time today. Dr. Goldfarb, thank you so much for being with us here today.
Thank you, Mark. Take care, everybody.
And we want to thank all of you as well. Thank you for joining us today. Thank you for giving us an hour of your time. Thank you so much for joining us. Again, please send any additional questions to rotman@emeritus.org. Thank you all so much, everybody, and have a beautiful day.